So in this project, we have actually managed to create a hybrid implantable sensor that has demonstrated to be useful at detecting or separating cancerous patients from those that are not having the disease. The clinical studies are still ongoing, so the final results are still pending, but the preliminary results are very encouraging. We have been able to detect and discriminate successfully samples from cell lines. That was the first level of complication. The second level of complication was to test it in clinical samples, and we were able to demonstrate that with success, and also with samples from patients that were collected in a retrospective analysis. Now, of course, none of these experiments was done with implanted sensor, as we were doing during all this time tests on stability, toxicity, biodegradability, biostability, and so on, which were also successful. So now we are in the time where we are actually looking at the results of the implantable sensor in vivo models. We are testing both eggs as well as mice. And so far the results are looking very interesting and very successful as well. For us at INL, we were responsible of developing the sensor itself, in particular plasmonic nanoparticles that are incorporated in the hydrogel. And we have a long track record of using this type of sensors to monitor the presence of very interesting biomarkers in the context of cancer, but also other types of diseases. But it's the first time for us demonstrating the ability of these sensors to be implanted and recording signals in vivo. For us, it's fantastic, of course, to see that we are able to have a tool that works during a period of time implanted in patients, but the actual impact of the technology and what it can have in the society is outstanding. For instance, our aim is to be able to monitor patients that have had the disease and that may have recurrence, and to anticipate recurrence several months or even years before the disease is visible for the clinicians. If we were able to detect and diagnose these patients earlier, we would be able to treat them appropriately and give them a much better opportunity in good prognosis and even full recovery. And this is what we actually strive for. So hopefully, if we manage to successfully continue this project, we will be able to maybe translate the technology to the society and have an impactful, let's say, results for the patients and their families.